The Warm Homes Oldham scheme is extremely important to the people of Oldham. I would say that every year in Oldham we face a public health crisis, and that crisis is called winter. We know that winter every year results in people dying prematurely. That's an unacceptable scenario in any society, especially more so if it's an avoidable situation.
When my boiler did actually pack in, it stopped working altogether. That left me with no heating and no hot water. I then went up to Oldham Town Centre to see what they can do, the council offices, and I saw a leaflet for warm homes. The warm homes scheme has made the difference from being cold and being warm. I can move around my own home, whereas last winter I couldn't do that because obviously I was isolated to the warm room and not the whole of my house. I have my house back. I like my house. The boiler has freed me from just worry for the coming winter, because last year I was poorly. The house was cold. That meant that I was in a bedroom that was cold. There was nothing I could do about that. I'm going into this winter with my diabetes under more control than what it was last winter. The blood sugar figures have come way down. It also helps the person to live in the community, which is, for me, is the best thing.
Before we had this boiler put in, we had an oil burner which kept breaking down. I made enquiries at Age Concern. The lady I spoke to suggested I contacted Warm Homes, which I'd never heard of before, but she gave me the phone number. I phoned them, and that it went on from there. The representative came to see me and sorted it out from there. So I've gone ahead with it and had a gas boiler put in, which we found better. It's easier to work and keep the house warm all right through. Well, I'm very grateful for the National Health to invest in it for anybody that can't afford it, to have the boiler put in. I think it's a good idea, keep them healthy rather than being ill and having to go to the health service for treatment. I feel more confident that the warmth will be in the house all winter, whereas with the oil boiler it was a bit dicey whether it would keep going all winter.
My boiler broke and I couldn't get the money to get it repaired. I was worried about not having a boiler because of the winter months. I was catching colds and having to wrap up. A lady knocked on the door. When I opened the door, she said that they was doing government funding, fitting new boilers, and would I want one. And I mentioned what had happened, that my boiler had broken, I needed a new one. And she sent somebody round and they checked everything and said that I would be able to have one fitted. I would recommend this scheme to other people. I have recommended it to my sister, my mum and a few friends. They helped and advised me to find a cheaper supplier for gas, so it would work out cheaper in the long run. If I'd not had the new boiler put in, I'd have had no hot water, no heating. I wouldn't have been able to bath us or the children, do the washing up or dry the clothes. It would have been a nightmare.
I do feel the cold, especially as it's getting towards the winter. And last winter there were times when we were a bit frightened to switch the heating on, especially on very cold days where we didn't feel, we'd had the heating on all day, and you do tend to worry about the cost of things. Since we had the Warm Home scheme, the cladding on the outside, we've had some decent sunny weather, and we haven't obviously felt the full benefits as yet. We have started to realise now it's getting colder in the evenings that we're having to put our heating on, perhaps for an hour, a couple of hours. But we have noticed that we're only putting it on for an hour, 2 hours, instead of maybe 3 or 4. And also, if the heating's not on for as long, it's going to save me some money. In my own case, I've been in hospital quite recently, and I do know that people are in there sometimes because of things that can be prevented. If they lived well at home, if they could put the heating on when they felt they wanted to rather than sitting in the cold. It's better to prevent at the beginning rather than at the end. It says it will obviously save the NHS money as well.
So the Warm Home Scheme in Oldham not only brings people out of fuel poverty, but just as importantly, it acts as a mechanism of preventing ill health in the first instance. There's a direct link between fuel poverty and illness. So to benefit the whole health system, we will result in a reduction in attendances for GPs, a reduction in attendances for hospitals, and also well-being for individuals. And this is a way of preventing illness in the long term. A particular benefit from the scheme is that of the collaborative working that's occurring, and that's collaboration between the health sector, social services and housing associations. We know that no one organisation is responsible for the well-being of patients, and therefore collaborating in this way is not only unique but also provides a more holistic way of improving the health and well-being of the population of Oldham.